Time to sit back, relax, and enjoy the show. Welcome to Breakfast with Spaniels with Dr. Judy Morgan.
I'm early. Or on time, depending on how you look at it. Need Facebook to push out the notices. Time to wake up. Ooh, Latvia's the first one in the house. Iveta, you're first. Sweaty, you were second. Awesome. Now it's waking you guys up. Slowly.
Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
All right. Good morning. Those of you who may or may not have gotten notice from Facebook. This is what happens when I show up sort of kind of on time early. Good morning, Bonnie. You're up early. Got to talk to Bonnie last night. She called me about a friend's dog with a bunch of questions. I had a bunch of questions too. So maybe she got the answers. So I don't know what is going on, but I saw a post on Facebook this morning in the Friends of page. And then we had another post in our new community conversation on drjudymorgan.com where one was a cat and one was a dog, and both of these animals for urinary problems had been prescribed sulfa drugs, sulfa antibiotics. And I may be a little bit biased because I was prescribed back in the 70s and 80s sulfa antibiotics over and over and over and over again for chronic sinus infections and bronchitis. And it ended up causing a severe allergy to sulfa for me. It was ugly. It was not pretty. When I had my anaphylactic reaction, my face blew up. I had two big swollen closed eyes. And so I went to work in the morning. This is when I worked for a really jerk of a boss. Went to work in the morning. My face was all swollen up. Clients kept coming in and asking me if I needed counseling, thinking that my husband had beaten me because my face was so bruised and swollen. And they all said, "Why are you at work?" I'm like, "Because I'm not allowed to take time off." And so at lunch break, we always close the clinic for 2 hours at lunch. At lunch break, I went to the urgent care, got a shot of Benadryl and epinephrine. So the one makes you comatose, and the other one makes you want to zing around the room off the walls, makes your heart want to leap out of your chest. So that was the combination of drugs that I had to go to work in the afternoon with my face still puffed up. It was a fun day, let me just say, fun day. Anyway, so I might be a little bit biased against sulfa drugs because that's what happens to me with sulfa drugs. But I'm also biased because I've seen what can happen to our animals with the use of sulfa antibiotics. Now, there's a couple different ones. There's the one that is used to treat coccidia. That one really doesn't get into the circulation as much. It pretty much stays in the bowel and kills the little one-celled parasitic organism. So that one gets used fairly commonly in dogs and cats, but doesn't generally cause as much trouble. But then there's the other one, the trimethoprim sulfa, goes by a lot of names, Ditrim, Bactrim, SMZ, TMPs. That one is a problem. And so this person with the cat, the veterinarian, the cat had urinary issues, so it was treated with one antibiotic. I forget what it was. Didn't get better, so they just said, okay, well, now we'll go to sulfa drug antibiotic. Yeah, no culture, no x-ray, there's a reason this cat still has a problem. So how about we figure out what that is before we choose one of the most dangerous drugs off the shelf, just empirically. Makes no sense at all. Um, and so the other one was on Facebook this morning. I don't know when she posted it originally, but I saw it this morning. The dog had urinated a bunch of blood. And so she was lucky enough to get in to see her veterinarian right away. But she said something about the fact that he didn't want to take x-rays right away because there was too much blood. What? Like, I think he didn't want to take x-rays because it was at the end of the day and it was time to go home, and but he could have said, hey, but come back tomorrow. And the antibiotic that he chose right off the bat was a sulfa drug, and also Previcox, which is a non-steroidal anti-inflammatory that is really hard on the GI system. I never even used that one. So we've got this bad combination that this poor pet was given, and now of course the pet is vomiting and has a bunch of other problems going on. So it's like, yeah, stop everything and let's get better diagnostics. So here's my reason why we stopped using sulfa drugs, sulfa antibiotics in our clinic. These are the side effects. Well, certainly you can have an allergic anaphylactic reaction like I had. It would be the same thing. In our pet, you'll get the swelling of the face, hives all over. That can progress to vomiting and diarrhea, which can progress to shock and death. Well, that's a pretty bad anaphylactic reaction. We don't see those that often, but when we do, it's, clearly not a pretty picture. But here are some other side effects. Cholecystitis, which is a gallbladder attack. So now we've taken a healthy animal and now we've got a gallbladder problem that could be life-threatening. Polyarthritis, which is an autoimmune disease where it attacks the joints. So they get swollen, painful joints and can't walk. Crystals in the urine. Okay. Blood in the urine. Urinary obstruction. Sounds like the perfect drug to use for a urinary tract infection. Dry eye, because this particular drug, sulfa drugs, cause a lot of autoimmune reactions in the body. So it will attack the nerves and the glands of the eyes, causing dry eye, which has a good chance of not being reversible. So you use the antibiotic for a week, now your dog's got dry eye that you have to treat for the rest of their life. Oh, by the way, autoimmune thyroiditis. Now you have a hypothyroid animal that you're going to have treated for hypothyroidism for the rest of its life. Liver damage, hepatitis, acute hepatitis, aplastic anemia and hemolytic anemia, bone marrow suppression, dehydration. Yeah, this sounds like the perfect first choice drug with no culture or anything to back up the use of this drug. Should not be used in animals with liver disease. Well, unless you do some blood work ahead of time, you may not know that your pet has some liver disease. Should not be used if they have any blood cell problems, for instance, anemia, hemolytic anemia, thrombocytopenia. I mean, there's just so many different problems that we could have there. Should not be used in the presence of kidney and bladder stones. Well, if we didn't do any x-rays, we don't know if we have stones. Shouldn't be used with kidney disease. Well, again, if we didn't do any blood work, we don't know if we have kidney disease. Should not be used in old, sick, or debilitated, pregnant or nursing, or animals with a folate deficiency. Folate's not one of those typical blood markers that we look at on routine lab work. So unless you do specialized lab work, you're not going to know if you have a pet with folate deficiency. And should not be used in black and tan dogs. This was originally found in Dobermans in particular. They seem to be particularly sensitive to it, but also Rottweilers, Gordon Setters, black and tan Dachshunds, Cavaliers. Black and tan dogs, for whatever reason, seem to be more susceptible to the side effects of this drug. Should not be used with antacids. Well, maybe you're giving your pet Pepcid or some other over-the-counter antacid. If you don't tell the veterinarian that, they don't know that, and they don't know that you're going to have a problem with this combination. Manchester's, there you go. Amantadine, not used commonly, but it is a pain med used for a lot of our seniors. Cyclosporin, well, that's being used a lot for other autoimmune problems and allergies. Digoxin, which is a heart medication for dilated cardiomyopathy and atrial fibrillation, thiazide diuretics, methotrexate, potassium supplements, or potassium-sparing drugs. It's a long list, like human drugs with horrible side effects. Well, this one has all these horrible side effects in people as well. We're talking about sulfa drugs. So I'm frankly shocked that in a matter of 2 days, I've seen 2 animals put on sulfa drugs because they're not very commonly used in the veterinary field anymore. They were very popular back in the 80s when I first started in practice. We gave it out like candy. We also gave out chloramphenicol like candy, which now they tell you to wear gloves and be very careful about handling it, and it causes bone marrow suppression and blah, 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 blah. And you have to have it compounded. You can't even just buy it. So, the drugs that we used to use, there's a reason we stopped using them. One, we got better things. But 2, so one of the things with the sulfa drugs, they're cheap. The sulfa antibiotics are much cheaper, depending on, because if you get a generic brand, they're much cheaper than all these new fluoroquinolones and super cephalosporins. And so they're cheaper. And that's, I think, why they're being used. But I don't think that's a good excuse. I don't think it's a good excuse to be giving all these antibiotics without good cause. Now, if you have a culture and it's resistant to everything else and it's the only thing that works, then you've got to weigh the risk versus the benefit. So be very careful with these and really insist. I know it costs more, but you really need to get that x-ray. Because if you've got bladder stones, I don't care how many antibiotics you throw at it, the problem isn't going to go away. You've still got the stone there, which is a nidus or a focus for infection and bacteria and pain and bloody urine. So you need to know. You need to know what you're dealing with. And this is why we are developing so much antibiotic resistance in this world. This is why we have superbugs, because we indiscriminately prescribe antibiotic after antibiotic after antibiotic without knowing if we even need an antibiotic. I get multiple emails every week where somebody has a pet that has vague symptoms, just not acting right. So they go in, the veterinarian really can't pinpoint what the problem is, so they just prescribe antibiotics. For what? For what? Why prescribe, well, he's just not right. We'll try him on an antibiotic and see what happens. Really? Which organ system are you targeting with that antibiotic for the general malaise? Are we targeting the lungs? Are we targeting the bladder? Are we targeting the kidneys? Are we targeting the bowel? Different antibiotics do different things. So you've got to have the diagnostics. Anyway, that's my Thursday rant. Everybody have a wonderful day. We might be getting some tile in our house today, we think. Maybe. Perhaps. They did a little bit yesterday. There were supposed to be 3 guys working. There was 1. So we're hoping for a little more forward motion. Next week we're getting floors. If I was a veterinary college, I'd be begging you to be a teacher. Oh, they don't like what I have to say. Dana, I don't use colloidal silver. I never have. I think high quality, really good colloidal silver has benefits. There's just a lot of really bad colloidal silver causing heavy metal toxicity in our animals and us. People and animals turn blue. So, just, quality. It's all about quality. How do you trust what your vet is saying? Questions. Ask questions, ask questions, ask questions. Don't be afraid to ask questions. If they prescribe something, you ask them what the side effects are. You ask them what to watch for. Always know what to look for. Have a great day, everybody.